I was diagnosed with basal cell cancer. I was devastated. I was shocked. Half of my ear was removed. The surgery took 16 hours.
The first question she asked was, what does it look like? It was only about a third of the ear.
When they said that I could do something to reconstruct, I didn't really see how it was possible.
To be able to see this ear sitting inside of her arm was just amazing.
I just can't believe he did that. I mean, are you serious?
We're back with Damien and his wife, Sherry, who underwent what doctors are calling a medical miracle. She grew a new ear on her forearm to replace the one that she had lost to cancer. She's here telling her story for the very first time on daytime television, along with the doctor who made it all possible. I want you all to please welcome the man behind this remarkable procedure, facial plastic and reconstructive surgeon and otolaryngology head and neck surgeon of Johns Hopkins, Dr. Patrick Byrne, who is on the phone with us. Dr. Byrne, actually, I should say, I'm sitting approximately 2 feet from Sherry and telling her how remarkable this result is. And I know you're not even finished, but how common is a procedure like this?
Well, thanks for having us on. It's incredibly uncommon. To my knowledge, I don't know if anything quite like this has been performed, this combination of procedures in North America. But her defect and that kind of challenge we face is something we do see many times a year at a place like Johns Hopkins.
You know, as both a head neck surgeon and a plastic surgeon, I can attest to the complexity and the difficulty and the uniqueness of this particular case. I mean, Dr. Byrne, you really used all of the latest, newest techniques that we have in reconstructive surgery to take Sherry to this place.
Yeah, Andrew, you're so right. I think I see it as she and I, all of us, are so fortunate to build on just a sequential advance in medicine and surgery. We combine all the knowledge we've gained over the years and try to apply it in a way to help our patient.
And when you're thinking about the process of how to reconstruct Sherry's ear, how do you decide, number one, we're going to use part of her ribs, and we're going to use her forearm as the skin to reapproximate what her ear might look like?
Yeah, it's a creative process. You know, I think of it as problem solving. We are faced with these really challenging defects on a routine basis at a hospital like ours, and we just start developing a treatment plan. And in her case, it was a plan we thought of many years before and really believed it would probably work well in the right patient, and Sherry was clearly the right patient.
And that forearm skin clearly has done a great job of reapproximating what your normal ear would look like. Now, Dr. Byrne, before we let you go, where does Sherry go from here in terms of surgeries going forward or anything else that needs to be done?
We probably will have 2 more procedures. We want to create what will hopefully pass as an ear canal. And then we need to shape the little structure in front of the ear canal called the tragus and the lobule, the lobe where she could pierce her ears in the future if she wants. And then we should be done.
So the fine-tuning parts, but the main infrastructure is there, and kudos to you, really a brilliant job.
Thank you, Dr. Byrne, for joining us and the great work that you did.
Thanks,
Keep
guys.
up all the great work there at Johns Hopkins.
Thanks so much.